Geriatric care, current roles and emerging trends. The Philippine experience. Aging is a natural phenomenon. Everyone grows old, except those who die young. You agree? Challenges in social or profession. Geriatric care, current roles and emerging trends. The Philippine experience. Aging is a natural phenomenon. Everyone grows old, except those who die young. You agree?
Risha.
Should start in a 1 minute time. Hello, Dr. Chandramouli, Dr. Lizan, and Maggie. How are you?
Very good morning, sir. We are all fine. Doing
Morning.
well.
Morning, Captain Chingaraja.
Very good morning, everybody.
Okay. Do we start?
Yes, sir.
We start on time, so we are able to complete on time. Thank you. Good morning to everyone. Participating in the third day of webinar series on international webinar on social work profession in geriatric care, current roles, challenges, and emerging trends. We have had 2 wonderful days. Last 2 days have been extremely indulging. We had so much of learning from practically 8 countries, which made presentations and gave excellent references. Distinguished speakers of this morning, Mrs. Lizam Painter, who is otherwise known as a matron from South Africa, Mrs. Varadagauri from Sri Lanka, Dr. Thandi Habana from Lesotho, Dr. Evangeline Guinto, and Mrs. Eva Ponce de Leon from Philippines. I'm sure one of you are not here because of some reasons, but I'm sure the other person is there and will show the video. Beloved partners, in our efforts to host this, I must also very cautiously welcome our partners in our efforts to host this 6-day, 2-hour webinars. Dear Dr. Mangaleshwaran, Dr. Lakshmi from Central University, Dr. Paneer Sigamani from Central University of Tamil Nadu, Dr. Chanavir from Central University of Karnataka, Dr. Nalini from Pondicherry University, Dr. Chandramouli, who is chairing the session from the University of Mysore, Dr. Leena Ashok, Manipal Academy for Higher Education, and finally Dr. Raja Samuel from the Madras School of Social Work Principal. We are, and the respected delegates from various countries, and in large numbers were attending this, last 2 days and today too, listening to very interesting talks given by the presentations and speakers, talks and presentations by the speakers. Now, I just probably briefly tell you the global populations are living longer thanks to improved healthcare. awareness about preventive health, and increasing number of smaller families, leaving the old people to fend for themselves. Increased longevity, all of us know, poses new challenge to the government, policymakers particularly, and the communities in which policymakers, advocacy organizations, private enterprises, families, and individuals themselves have a great role to play and not remain mute spectators. I think we're all forced to act. I think that is of this big seminar, international seminar and webinar that we are organizing. We are all wanting to do something seriously to see that nothing adverse happens in respect to the quality of life of elderly. There are international instruments such as Madrid International Plan of Action on Aging, WHO's Decade of Aging, which was very recently launched last year, United Nations open-ended working groups, which talks about the human rights of the older persons, and plenty of policies and legislations that are acting, that are enforced in various countries that we are all representing today. And they're all meant to protect the vulnerable older persons. And international advocacy bodies like International Federation of Aging, based in Canada, of which I was the president, global president from 2012 to 2014. And I also served the board for 10 years of time. And the second global aging network based in Washington, I served the board also for a few years of 5 years of time. And the International Association of Gerontology and Geriatrics based in Vancouver, which is also an active organization, and US-based AARP that has millions of members as their in their calendar. International Network for Prevention of Elder Abuse, which talks about creating awareness about elder abuse that are happening all over the world. They all together and collectively, independently, lobby for aging becoming an important issue, particularly in the United Nations, where the governments participate actively from all over the world. The International Federation of Social Workers is one such organization. I've not been familiar with that yet, but I hope after this conference we are able to get connected with them and see what we can do collectively as far as the social work geriatric care is concerned. We need to probably discuss this across, and we must spread across the countries to talk about social work gerontology or geriatric social work. Now, primarily because I think one area is countries like India, and I'm sure many of the Asian countries, including Philippines, migration are in a big way outside their respective countries and also within the countries. Understand posing challenges to parents who are getting older, and when the longevity increases, the frailty causes problems. I remember one of the speakers, Margi, was talking about it. Frailty should be converted into proactive, mobility. I think it's important that we really talk about this and the role of social workers in these kind of efforts. Community care and institutional care, home care, and a variety of the services are becoming an important aspect of our efforts. And social workers who are actually involved in this can play a predominant role within families, neighbors, coordinating with the doctors, nurses, home healthcare providers, and institutions for homes, which are probably a last option for the old people to move to. You remember, some of you who have attended the program, Mr. Marcus Riley beautifully said about how the social workers in their organization in Australia work in a multidisciplinary team and how their importance is being felt as years go by. I think this is something that we need to really seriously discuss. Now, I still need to mention, despite repetition, social workers in many countries play a significant role in rendering care to the senior citizens, while in most others, the role of social worker is yet to be recognized. While if this might happen, I can tell you that in India, we are very proud of the fact that the government of India is funding NGOs for running old age homes or senior citizen homes, and they they mandate that a social worker should necessarily be engaged in those homes, which means, at this point of time, I see minimum 400, social workers working in these old age homes across the country, which number might increase over a period of time. How do we utilize them? How do we ensure that they promote, better quality of life is all the purposes. I think these are all some of those points which I made us think that we should discuss about this internationally. So keeping these as a major objectives, we at Heritage Foundation requested the universities imparting social work degrees and post-graduation to partner with us to debate how we move ahead. I want to welcome you all on behalf of Heritage Foundation and the partners, numbering to about 10 of them. I think we are delighted to have them partnering with us, and we are seeing them actively chairing sessions. I think their importance is something that we recognize. And at this point of time, we value everyone's time and efforts and amongst us to learn. We want to facilitate proper learning. Please ensure that you support us in our efforts to facilitate this process. We are honored to host this seminar to generate many takeaways as part of our collective learning through sharing. You have seen already 8 countries. Today, probably 3 more countries are going to give 11. So 11 countries, what is happening around on social work and the geriatric care is something that all of us have a lot to take back. Before I really close, as usual, I really want some gifts from you people for doing all that we do. Number 1, please acknowledge the speakers when they finish their talking, at least by raising your hands on using the button available in the Zoom. I think it's a small token of appreciation that it will be a good gesture on all our part to do that. 2, please never unmute your telephone. And never unmute your Zoom, because it will cause us a lot of troubles. Please don't do that, for heaven's sake. Use chat box to make any comments about what is being spoken, what is relevant for this 6 days of deliberations. Please do not write anything other than that in the chat box. We do not want anybody diverting the attention of those people who are listening to by writing something that we do not want to encourage. Now, feedback from, I think feedback form will, as usual, come to you at the end of all the speakers making a presentation. And any of you still use that in the chat box when it comes. Please do not promote your personal interest and personal activities in the chat box. We do not appreciate it. And those of you who want a PowerPoint presentation, please write to us at the end of 6 days. We'll be very happy to share with them. In the meanwhile, today, Dr. Varatha Kauri, who is one of the speakers, have requested that we can share with the PowerPoint presentation today, and probably our office will ensure in the chat box when the PowerPoint made by her will be hosted. You can all take copies of it whenever you want on that, and that will be done at the end of the program, not during the sessions. I think yes, from Philippines, 2 are expected to talk. 1 has not been able to come, but she has sent us a beautiful video, and the other person will probably be there to answer any questions. With this, I also want to introduce Dr. Chandramouli, who is the head of the Department of Social Work in the Mysore University. His interest in aging has been absolutely immense. That's how he joined us to be part of this efforts. And I request him to kindly take over and chair the session. Thank you very much once again. Have a nice 2-hour session. All the very best to all of you. Take care.
Thank you, Dr. Gangadharan, for giving a very good opening speech. Now, today is the 3rd day of the international webinar. Am I audible, sir?
Yes. Go ahead.
Okay. So I welcome all the speakers as well as the participants to this 3rd day of the international webinar on social work profession in geriatric care, current roles, challenges, and emerging trends. So today we have got 5 speakers. Dr. Evangeline Mahine Ginto from Philippines, and Mrs. Eva T. Pounds de Leon from Philippines, and we have Mrs. Varatha Vasudevan from Sri Lanka, and we also have matron Dr. Lizanne Painter from Southern Africa, and finally As a fifth speaker, we have Dr. Thandi Havana from South Africa. So I welcome all the speakers once again, friends. Now, I introduce the first speaker, Dr. Evangeline Mahime Ginto from Philippines. Well, Dr. Evangeline Mahine Ginto has her master's in social work from Philippines Open University. She has done her PhD in educational management, and she now works as the Doctor of Social Development at Philippines Women's University. Well, Madam, I welcome you to take over the video, your chance. Please make your presentation. Thank you. Over to you, Madam.
Prabhakar, you should play the video.
Yes, sir.
Challenges in social work profession, in geriatric care, current roles and emerging trends, the Philippine experience. Aging is a natural phenomenon. Everyone grows old, except those who die young. You agree? There are two types of elderly, according to Erickson. Those who are in ego integrity and those in despair. Those in ego integrity, they contemplate on their accomplishments, and when they are proud of them, they feel a sense of integrity. They look back on their life with little regrets. Whereas those who failed to fulfill their task during this stage may feel that their life has been wasted and look back on their life with many regrets. They face the end of their life with feelings of depression and bitterness, and this results in despair. So these are the two types of people that social workers encounter every day as they work with the elderly. Those who are happy continue as leaders. Social workers may assist them to fulfill their aspirations in life. Those who are unhappy needs social workers who would help them identify their unmet needs, to process those ill feelings and attain healing in their lives. I'll go back to the functions of social work. It's just a little review that we have the preventive functions, promotive or developmental functions, remedial or rehabilitative functions, and the residual functions. These we social workers combine as we do geriatric care. An example of activities that we do to prevent despair or the preventive approach, we do picnics for the elderly or an exercise to make them alive and encourage those who are loners to join a group. As to the promotive or developmental functions, I will show you a sample of a group of elderly who do not stop working for their community. I have here a photo of what they have done. They urged me to write to a government agency in charge for confiscating illegal logs. At first, I did not believe, but I just comply what they want me to do. Then I wrote the letter, gave it to them, and after several weeks, to my surprise, they were able to receive these logs. And then here it is, started the construction of a multi-purpose building for the children in their community who do not have a daycare center. And this is an example of what social workers are doing using the developmental approach. They also build support groups from other sectors and organizations because, as I've said, these types of elderly do not stop working. They have been leaders when they were young, and yes, they are in their ego integrity. Now I will go to the remedial approach or the rehabilitative functions. Almost all senior citizens placed in residential homes are those who are in pain, neglected, abandoned, or even abused. Thus, they need the remedial approach. They are placed in a government facility known as Home of the Elderly. And most of the time, this calls for a clinical expertise, especially for those elderly with deep-seated problems. We also need to work with a multidisciplinary team as we wanted to help this elderly. Social workers in this do psychosocial processing and spiritual upliftment sessions so that they would be able to process what the elderly have experienced in life. In all these functions, social workers need not only compassion but also competence. We must be guided by theories. We must have skills and techniques, and most of all, the right attitude in working with the elderly. The last one is the residual function. Residual services are provided by social workers to senior citizens who are physically or psychologically non-functional. What I consider as most challenging role of social workers in geriatric care is the end of life care. Those who are left and abandoned, and only social workers are around during the final call. As much as we can, we give genuine care. We restore their dignity as persons, and this is the best time to show our respect for the final departure. Very sad for social workers who have been feeling close with the elderly. And there are times when within a week, they send forth elderly one by one. Social workers also get the services of a prayer leader, but if nobody is around, they do it alone. They do the prayer service on their own. So here we live by our philosophy. We believe in the worth and dignity of all human beings, and as we work with the elderly, we have to realize this philosophy.
Greetings. I am honored to speak to you today and share what are identified as the emerging trends in the care, treatment, and responsibilities in regard to our country's elderlies, or more popularly referred to as senior citizens, 60 years of age, who at present account to about 20% of our population. Our culture and traditions as Filipinos have laid significant emphasis on the family and the respective roles of its members, young and old, and had been of continuing impact on our way of life. Caring for the elderly is a strong cultural value in the Philippines, deeply rooted in the Filipino society, as it is invariably also in most of Southeast Asia. We Filipinos value filial piety and caring for the elders in the family. Culturally, as Filipinos, our families are generally both the center and origin of many activities. It is not uncommon to find multi-generational families living together and committently to find interdependence amongst family members in addressing and meeting various family needs, plans, and challenges within this extended family structure. The responsibility to help each other out and the sharing of resources for mutual benefit is naturally expected. For that reason, the elderly usually live with their families, living in multi-generational households and communities. Put into sharper focus the responsibilities and the care of the elderly. However, this has not always been a positive outcome. Emerging trends throughout the years greatly affect society, particularly the elderly. Trends related to work, health, the status of living, and family support. It is common among Filipinos to have an average of 2 to 3 rooms in a house. With large number of family members and prohibited cost of land properties and building houses, it is not logical to find that house structures are mostly small, the spaces inadequate, and to that extent, these houses are not really that comfortable as places of abode. Bedrooms as basic necessities have become too luxurious and often beyond the family's reach. Large families with small homes have to make space adjustments for livability, and with the utmost care for the young ones, it is mostly the elders of the family who make the necessary sacrifice. Their limited space at home hardly keep them comfortable, to the extent that even their peace of mind and sense of security are impacted negatively. They then have to sacrifice for the greater good of the family. These difficulties confronting our elderly are very common to Filipino households. It is, however, comforting to observe that quite a number of organizations, both government and non-government, have become aware of this trend that affect our elderly. These organizations have established homes for the elderly, retirement and nursing homes that cater solely for senior citizens are fast becoming commonplace. With these emerging trends in elderly care, much of the negative implications cease to be. However, a few thorny issues have remained, notable of which is the common reluctance of many seniors to separate from their respective families due to their inability to meet the cost of their transfer and to overcome the loneliness of family separation. With the necessity to provide for the needs of the family and the burden with a high poverty rate, Filipinos resort to working longer in their jobs. Unlike before, where men are the ones working to provide for their families, women of this generation are more regarded as co-breadwinners of the family. In situations where both husband and wife are working to earn more, their busy schedule, while allowing for bigger income, compel the parents to leave their children at home in the care of their grandparents. Similarly, many of these Filipinos travel to greener pastures abroad. With the rising demand for overseas Filipino workers, this has become a dilemma. While invariably the income abroad is substantial, the costs in terms of family separation is equally, if not more, substantial. The results in general are broken families, children going astray for lack of adequate home care and discipline, and frustration among the elderly who are often the ones left behind to care for the children, contrary to their expectations that in their old age they are the ones to be cared for and that they too do the difficult task of family care and strengthening. Seniors very often take care of their grandchildren, not just on weekends or for months at a time, but for the duration of the parents' work abroad. The resulting chain of reaction affect the children who are growing up in the absence of their parents, as well as the elderly being deprived of the peace and comfort of retirement and self-care due to the added burden of being substitute parents. An aging population increases the demand for health service because of older people, degenerative and communicable diseases. In the Philippines, the number of elderly is increasing at a pace faster than the growth in the total population, and by 2020, it is projected that the country's senior citizens will make up around 16.5% of the total Filipino population. In response to this, our government have put in place by legislative and or administrative actions that bring immense benefit for the elderly, among which are social pensions, universal health care, expanded senior citizens grants, and the Department of Social Welfare and Development's Pantawid Pamilyang Filipino, a bridging program for the poorer sectors providing monetary grants, Philippine health insurance, and most especially free health service for elderlies. Our country still has so much to do to adequately meet the needs of the increasing number of our aging population. Our government sustained support to the enhancement of our healthcare and financial grant system for the aged could translate to a better quality of life for them. With all of the social amelioration programs for them, our senior citizens can be assured of not being left alone or feeling deprived of what they deserve as part and parcel of responsibility during their time, and still look forward to better living in the sunset of their lives. This is the happy give and take in Philippine society. Our elderlies gave their best in the building of our communities for the generations to come. Rightfully, they should take and receive all that they deserve from society. Thank you.
Thank you.
Well, the doctor has opened up the topic with a statement. Aging is a natural phenomenon, Philippines experience. She has explained that the elderly persons have been suffering from various problems, particularly with depression. And in such situations, social workers have a greater role to play with a variety of functions to perform, like the, the preventive functions, promotive functions, developmental functions, the remedial approach, and also residual approach. And the doctor has also guided that the social workers have a greater role to play while doing the psychosocial approach as well as spiritual upliftment of the morale of the elderly persons. Besides, the Philippines government has also taken up a lot of measures in the form of enacting legislations and also providing suitable health insurance schemes. My dear friends and the participants, the session was really very clear and transparent and also highly educative. Now I welcome all the participants to post their questions in the chat box if they have any questions. I think all of them have expressed their happiness, their appreciation. There are no questions. Okay, some of them are saying that the session was very informative. Very interesting. I think we should go to the next presenter now. Friends, I welcome the second speaker of the day, Mrs. Eva P. Pons de Leon from Philippines. She has done her master's degree in social work from the Asian Social Institute. She is the president of Philippine Association of Social Workers since 2008. I welcome Eva P. Pons de Leon. Please take over your presentation. You can speak now.
I don't think she's there.
Okay.
She told me she'll be there, but I think we should move on to the next speaker.
Oh, it's fine.
Yeah.
Shall I welcome Mrs. Varada Gauri Vasudevan?
She has written there. I think there is a message from her saying that thank you so much for your appreciation in the chat box. Yeah.
Okay, okay.
I think we are not able to see her, so let's move on to the next. Thank you.
If such is the case, I will go to the next speaker, Mrs. Varada Gauri Vasudevan from Sri Lanka. Is she ready, madam?
Yes.
Oh, yes. Mrs. Varada Gauri Vasudevan from Sri Lanka is a director training attached to the Institute of Social Development in Sri Lanka, the Ministry of Finance. Well, Varada Gauri Vasudevan has a master's degree in social work, specializing in family and child welfare from the Tata Institute of Social Sciences, Mumbai, India. She has introduced Reflective Learning Journal for undergraduate and postgraduate field education programs at School of Social Work in Sri Lanka. Her research interests include around 8 important areas like the field education and training, social work curriculum development, family and child welfare, school social work, community-based child protection, elder care, volunteerism, and institutionalized care. Madam, you're welcome to the session. Please speak up. Thank you.
Good morning, all of you, and greeting from Sri Lanka. I'm very pleased to talk in this international forum on challenges in social work profession, especially in specialized field in geriatric care, current role and challenges and emerging trends. This presentation is focused on emerging trends in Sri Lanka with regard to geriatric care. And as you all know, is a very beautiful small country, Sri Lanka. It is an island, and population is 21 million. Growth rate is 0.6, and life expectancy is 76 in 2019. And elderly population is 12.5 when we had a population statistics in 2012. Now, of course, it's improved. And the population is projected figure is now increasing rapidly other than the other Asian countries in global. It's in line with developed countries. That is a big challenge in Sri Lanka. And this population over 60, in Sri Lanka, we define elderly as 60. 60 is a retirement age. And over 60, the elderly population is continuously increasing. In 2030, we will have 5% in one elderly population in Sri Lanka. 20% of population will be elderly in 2031. So we need to prepare. So this webinar will be a very timely organized for our nation. And the pattern, when you looked at the pattern and the trend of aging in Sri Lanka is ahead of other South Asian countries in democratic. It is aging relatively faster. And also Sri Lanka is having a good social development indicators, but we are facing a huge economic challenges. Sri Lanka age composition is shifting from pyramid to pillar, that as you all know. Changes are happening at a much earlier stage of development than the other countries that they are facing aging. They are facing aging. Those countries are already developed countries, but we are still developing countries, but we are going to face a huge problem in aging. And the socio-cultural norms, such as living arrangement and social protection need to be developed. The implication of an aging population on labor force participation. Since we defined elderly as 60, and we also will have a problem of labor force participation and potential labor shortages. That is very important trend. The impact of aging on health. And again, you all know long-term care and the health, elderly care is very costly. And Sri Lanka, as you all know, we provide health and education is free for all. It's a welfare state. So the impact of aging on health and long-term care will be a challenge for us. And again, another important emerging trend in population is 1% household is emerging. It is an emerging issue in social work practice as well. When person is staying in one person at home, who is going to care? And isolation and the living arrangements and the aging and how we are going to care the home-based learning. Are we having services expanding? And the health and disabilities. We have to prepare in advance for a health and disability, and especially the labor force participation. As traditionally, women are caregivers. The women are still, the child care and the elder care is very important. Though we have 97% of literacy rate and only 33% of women participation in labor force. So the labor force participation, increasing income is another emergency tendency for us to practice in the area of economy and social work in social work practice. And we are not covering, though we are giving a providing social welfare services, and which is not enough to maintain the standard of living. So the social protection measures need to be developed. And the social welfare, when it comes to the elderly people, we have an authority, National Council for Elders, National Secretariat for all Elders, which have been established under protection of the Right of Elders Act and the National Policy for Older Peoples. So we have legal provisions to practice geriatric care in social work. That is a very big advantage and the benefit for social workers, and we may have a legal practice within that. And again, when we come to the system, how far we have developed our social security system, which is not enough. And we have public pension scheme, that's those who are government jobs. and the mandatory contributory for private sectors, employee provident fund and the EPF, ETF and all, and other voluntary contributory schemes are there, but people are not aware. So there is another area of social work practice to awareness to include in the social protection net. Farmers' pension schemes, farmers themselves, they are not aware. So the rural social work is very much needed. And fishermen pension schemes and pension schemes for self-employees. We all know the self-employees, they earn, but they have a little saving habits. And the emerging trends in practice in service delivery. So as per our act and the very good national policy, and we established the social welfare provisions, gas grants program, and their centers are 54 in island-wide, village level committees, 11,445 village level committees to support services, and divisional level committees to provide facilitation to the village level committees, and again district level committees to look after the elderly care and the elders development. And again, another important features, very good features, the maintenance board. As traditionally, the Sri Lankans give a care take at the family based. So some of the parents are complaining. They can file a case at the maintenance board to get a maintenance from their own children. So there is a board every Thursday. It's happening at the elderly secretariat, and it is not like a court environment. It is very elderly friendly environment. They can come and file a case against their own children, and the mediation board will mediate between the children and parents to promote the care. And again, the very important program, the intergenerational program at school level. The school children are socialized to how we have to look after our own elders. That is the program is island-wise is happening. These all welfare program is done by government services. And there are a few number of NGOs like International Help Page and some other NGOs are helping for communities. And another research, interesting research evidence for emerging trends. Younger generation still believe the family members, particularly their children, being responsible for their aging parents. This research we have done in collaboration with the Japan University, Tokai University, among the young university graduates ages 20 to 22. This evidence highlights 79% of students in Sri Lanka are not aware of active aging. Still, they have a aging is like as what we consider as myths. Myths are there. So the majority of students are still, they are not aware of active aging concepts. That there is a practice opportunity. Almost all of them agree there are old age based prejudice and discrimination among themselves. So these evidences cited the importance of social images. We need to develop social. We cannot we can construct the social, elderly friendly, active aging concepts. We need to make a social formation, social construction of elderly must be practiced by the social workers in Sri Lanka. And the emerging trends in service delivery, increase in private nursing homes and private home nursing opportunities. These are very expensive for only the affordable people can access. And the long-term homes, expanding opportunities for community-based self-employment through self-help elderly committees, village level committees, and special discounts for senior citizens for prescription drugs, and special interest rate for bank deposit. Ayurveda health seeking behavior is another emerging trend. They believe in Ayurveda health and registered voluntary homes 309. This look after by the elderly secretariat again. And the government homes only 6, and the other voluntary homes are looked after by the department elderly secretariat. And the social work education and training when come to the geriatric care. We have number of para-professional training in elder care. The NVQ level, vocational level curriculum is also is available for elder care modules, NVQ level 3 and 4, 5, and elder care center management also is there, care management centers, those training, the managers, welfare center managers should be trained how to manage the centers. And again, we have at the National Institute of Social Development, which I belong, BSW program and MSW program, which are a generic social work program. We don't have a specialized station, but still we have a stream to specialized in elderly care. And 1 year stream, they can specialize only 1 year stream for elderly care. And the training for continuous professional development, we have a diploma in social work, social care, and diploma and high diploma in social work, and the diploma in gerontology and elder care, and diploma in counseling. Those who are practicing, those who are working with elders, those select this program and get training for their skills development. And what are the challenges? We need to redefine the elderly. So are we using the elderly, the word elderly need to be redefined and we have to make a social construction, a positive social construction on elderly. And the growing old before becoming rich. These are the economic challenges we need to promote the macro and microeconomic development. And the lack of social security measures which need to be developed. Again, there are huge challenges for us. And social work as an academic discipline and practice-based profession, but still in Sri Lanka, it is not a legally recognized profession like other professions like law and medicine. And there are officers responsible for elder care, elders' right promotion officers, practice as social workers, but not in the name of a social worker title, but their job functions are related to social work. Again, we don't have the title of social work in our occupational standard and the cadres. And the few higher educational institute and my institute, National Institute of Social Development, which is very historical institute, only one institute. Last year, the University of Peradeniya has started a bachelor's degree and the master's degree. So the only 2 social work institution is providing social work education, so which is not enough for a growing population. And the lack of quality of para social work professional training to cater demand of caregivers. The caregivers demand is increasing, so the private nursing homes are training of a particular function, and then they are allowed to service. So the quality of para social work professional trainings are much needed for that. And again, what we are looking of our lack of legal recognition. And what is the way forward from the professionalization of social work? And we don't have a national core competency within our indigeneity, within our national cultural, multicultural context. So we need to develop a core competency in social work profession, and we need to also develop the social work education and training in specialized area like geriatric care and other areas of social work practice, and the occupational standards for social work, and the national code of ethics. Still, we don't have a national code of ethics. We practice international social code of ethics for social workers within our administrative rules. And the social work to be legally recognized as a profession in Sri Lanka, and the Social Work Council to be established to monitor the services efficiency and the quality assurance mechanism. And these are the references are available. And if you anyone want, and we can send it to the some of the research through our organizers. And thank you very much.
Okay. Thank you, Dr. Mrs. Varada Gauri Vasudevan. You have spoken so lucidly, as well as with what you call a very valid collection of details on the topic of emerging trends in social work profession in geriatric care, Sri Lankan experience. So you have given in your speech a very an outlook about the Sri Lankan society, about the population, particularly the aging population. You also have enumerated that the cost of maintenance of elderly is going up enormously. Well, to meet all the requirements of the elderly persons, many social welfare activities are being implemented by both the government as well as the non-governmental organizations. Good number of social security measures like pension schemes, farmers' pension schemes, and pensions for the fishers have also been implemented by the government. You also have covered that in the emerging trends, a lot of things are happening to protect the dignity and worth of the elderly persons. The Protection of the Rights of the Elderly Act was implemented in the year 2000. The National Secretariat has been established. Daycare centers have been brought up. Village level committees, district level committees, and also divisional level committees have been set up to look into the matters of the elderly persons. Well, scope has been given to develop the income generation programs also, and an attempt to educate the school-going children about taking care of the elderly persons is being widely practiced in your country. You have also narrated that even at this point of time, children are responsible for taking care of their elderly parents. In the social, coming to the next part, you also had said that social work education is being offered in the form of both BSW as well as MSW courses. So in your country, bachelor's degree in social work as well as master's degree in social work has been provided to the students. It is a good welcome change. It is a very good thing. Now coming to the part of challenges, you have given very enlightening as well as alarming picture about the challenges being faced by all of us, irrespective of your own country. It is a universal phenomena that most of the challenges being faced by the elderly persons are universal everywhere, right? So finally, you touched upon the issues of professionalization of social work in a very clear way. So, Dr. Vasu, Varada Gauri Vasudevan, your presentation was really enlightening. And now I welcome the participants to raise have an interaction with them. If you have any questions, please pose them. Okay, many have appreciated. There are no questions. That means, your presentation have really reached every one of us. Thank you. Thank you very much, Mrs. Varada Gauri Vasudevan.
Thank you.
So now I will go to the next speaker. May I welcome Matron Dr. Lizanne Painter from Southern Africa. Are you ready? You can unmute. You can unmute now.
You need to unmute. Yeah, she will do that. Yeah.
Okay, fine.
Okay, click on here.
Matron Dr. Lizen Painter from Southern Africa is a well-known social work practitioner in that part of the country. She is an expert in elder care for the last 19 years as a registered nurse, matron, and also
This one.
nursing home care in the Western Cape of Republic of South Africa. She has an expertise as a collaborator with medical professionals. She has extensively worked in the field of dementia and psychiatric nursing care of the elderly. She has developed in-house spiritual care practice and palliative care functions along with social workers and medical professionals. Madam, Matron Dr. Lisan Painter, you're welcome to the session. Please take over. You can present your speech.
Good morning, everyone, from a very cold Cape Town, the tip of Africa. It's a privilege and an honor to be present. Just a slight correction, I'm a registered nurse, not a doctor, and I work in a very small, privately run, family-owned nursing home, but I have quite a lot of experience in working with social workers. Thank you for this opportunity. Here you see a little photograph of our care facility and just the beautiful opportunities we have to participate in the broader sector of social work and care of the elderly. Okay, the screen is okay. You want to go to the next one? Yeah. So social workers in South Africa work within the communities and in the legal spheres and in the governmental spheres, either as NPOs or NGOs, and in the private spheres. But finding the social worker has the opportunity to find the right fit for themselves. Here we have a indicator of social workers in the government sphere. And you see a picture of me receiving our certificate from the Department of Social Development as a registered frail care. In South Africa, social workers have quite a lot of authority and are employed by the Department of Social Development and the Department of Health as inspectors and actually carry a lot of weight in terms of registration and in implementing the Older Persons Act regarding the care of elders in South Africa. Some of their roles include investigation and compliance minimum requirements of the Older Persons Act for frail care facilities. They also guide and educate managers towards compliance and requirements of the Older Persons Act, and they produce a compliance certificate, and they also help you maintain your certification. So it is a very large part of the policy in South Africa that social workers have authority and function very highly in making sure that standards are maintained. There is quite a vast difference between rural living and city living, with concentration of social work quite good in the city areas. In the public hospitals, social workers function in the counseling sector for personal counseling, family counseling, psychiatric counseling. They're very much part of the healthcare system in the public clinics. Here you see a picture of a rural clinic where people have to line up for care, and they run support groups. They work with the intake of clients, and they write referral letters to deeper care requirements, and they make social interventions. There is legal representation in the public and the private sectors. So social workers in South Africa carry a lot of weight in court appearances for the protection of the rights of the elders. Of course, they also have other roles in terms of child care, child protection, and there's a vast array of roles that they can play. But in my sphere of elder care, particularly dementia care, court appearances are quite common because social workers are also very involved in elder abuse interventions. They write reports and do care planning, they do follow-up, and they also facilitate placements in care facilities or in home care, and they do lots of referrals to other fields of healthcare. They play a very large role in moving the wheels of care for elders. Social workers in private practice in South Africa may work in private hospitals, and they facilitate within the multidisciplinary team discharge planning, collaboration in the referral team, and they give input as to the suitability of the care option, and they do bedside counseling of the patient and or the families. But we're moving very much away from a terminology of patient and a medical model, and they're supporting much deeper insight into the needs of the elderly and the personhood of the elderly. And with their counseling background, they're really changing the dynamics of how we view elder care in South Africa. They also work in an emerging trend in South Africa for what are called step-down facilities. So when elders come out of hospital, they have the option, especially if they have medical aid available, to go down to step-down facilities where social workers form part of the care team of professionals. They work closely with OTs, occupational therapy therapists, registered nurses, to return the elder to functionality, the highest level of functionality possible. And this requires assessments done by the social workers, and they assist in placing their care people in short or long-term care homes. They act as a resource person, a referral guide, and a family counselor. Their roles in the communities are quite large, and they cast a long shadow of hope for the elders. So the choices come down to care at home or care in a care facility, and they make assessments of the needs of the elders in their circle of care. So they will do assessments of the elder either in a hospital setting or a step-down setting or in an in-home setting. And for that, social workers, especially in private practice, will do home visits. They will then have their circle of referral facilities and will look at placement suitability. In private practice, social workers will have quite a large circle of places that they like to place their elders. And they have a vast influence on where elders will find suitable accommodation. They do a lot of transition counseling. So in other words, they prepare families and elders for transition. There's a lot of thought put into where elders are best suited. So they're not just sent anywhere, or as in some population groups in South Africa would refer to putting away an elder, which is very sad thinking. So looking for a place of community where the elder can experience community, where the social worker is also involved in the communities in which they work, a spiritual care focus, and particularly an emerging trend is addiction recovery support. So we have eating disorders, alcohol, abuse behaviors, drug addiction, and other kinds of addiction where medications can be abused. They offer referrals and they collaborate with the placement and even the process of placing elders in care facilities. Their biggest role, from my perspective, is their legal referral role and the legal interventions that they make. And a very beautiful emerging focus for social workers, especially in the government section and in the private section, to play the role of curatorship. And I'll go into more detail about what curatorship is in South Africa. Regardless of whether they're in private practice with individuals or in a hospital setting or in a governmental relationship, relationships always matter. And there is a great shift in South Africa to person-centered care and appreciation of eldership. We also have a matriarchal system in South Africa. I've listened to some of your talks where the mothers are and the elders in the home are considered valuable. Some of the challenges that are faced in South Africa are mandated through the Older Persons Act. And there is quite good legal representation for elders who are experiencing any kind of deprivation or abuse. So the social worker, either in government, hospital practice, or private practice, will provide reports and insight for elders needing to be rescued from abusive situation or placed because of abusive situations. So they support the multidisciplinary approach to curatorship applications with the High Court. And they will appear in High Court to present the needs of the elder. Elder abuse and emergency support. So here you see a picture of an elder being transported via ambulance. And as a manager of a care facility, I've even been involved in attending a social worker at a police situation and an ambulance removal situation of an elder from an untenable home situation into the care facility that I run. So social workers have a very large sphere of practice in preventing and providing emergency support. And then the biggest challenge for a social worker is the financial restraints. First of all, for the clients to be able to afford the work of a social worker in their area of need, and then their financial restraints of community members and elders in the community and families to be able to afford care facilities. There are vast variations within the population group of South Africa. And many times, even though you see this beautiful mountain, it feels like you're standing on the edge of a precipice because we have a lot of languages and there are language barriers between population groups. So social workers need to be able to speak a number of languages, even in a city setting. There are many people groups. And within the people groups, there are vast differences between availability of services in the rural and in the city living groups. There are also time constraints because when you have a legal situation of elder abuse, you have to move quite quickly once you become aware of an elder experiencing deprivations. So time constraints can be a very big burden on a social work practice. There are fiscal responsibilities and the cost of a practice. And there's limited resources. In other words, some social workers may have a very large practice, but not have enough finances or resources to place an elder who can't afford care. And they carry huge case and client loads. Emerging innovations, emerging trends is that social workers are at the forefront of developing social programs such as Senior Olympics and fitness care, such as what Margie van Zyl Chapman my colleague presents, addiction support groups for elders. And in our home, we had quite a lot of social work intervention, running support groups and individual therapy for elders with addictions, especially alcohol addiction. Then there's other groups that employ social workers, NPOs and NGOs, such as Dementia SA and Alzheimer's SA, who run support groups and actually provide carer training. Some of my role has expanded in receiving social workers who run training programs, particularly Dementia SA, and we have provided an opportunity for their social workers to enter into the daily living care needs in a care home so that they can actually be competent to teach care practices within their organization. So social workers carry quite a lot of influence in placing people in daycare. Then we have the Eden alternative way of thinking, and the emergence of pet therapy, music therapy, art therapy, and referral to these kind of therapies, either in the home or in the care facility. And then there's community-based home and facility care training and accreditation. And social workers in these NGOs actually have educational accreditation skills. Further emerging trends and innovations are that the South African education system is able to train social worker aides or assistants. There's a significant improvement in community home visitation, senior daycare programs, and social workers to place people in senior daycare. Active aging talks and outings, and then social workers in private and social practice are able to assist elders to receive grant applications and financial support from the government. Here you see a picture of some of our elders receiving physical exercise groups, and this is one of the groups in the home that I run. Further emerging trends are legal support for the elder and family, community support care agencies, spiritual care as part of the total care, particularly when there's palliative care. Personal references and stories are known. We like to know our elders, and the social worker who does the counseling has a great opportunity to communicate on behalf of the elder in their care and in their ability to place, to be known. And the personal relationships between elders and social workers are easily translated into care opportunities that recognize the value of each person. So personal preferences and stories are known. There's a great move to personalization of care. There's nature and pet therapy included, and there's an emergence of care technology. I've been blessed to participate in a new company in South Africa called VivaViv, who's developed technology through the use of cell phone and cameras and a charting procedure whereby they can either take care of elders in a residential care facility or at home, and the multidisciplinary team can actually check in and be logged in to a computerized or a phone setting to review how things are in the care environment. Then there's geriatric specialist work. I'm not aware if there's special accreditation for specialist work in South Africa, but certainly in terms of dementia care, social workers are very essential and have great experience in where to place their clients. And then a very large role that I have been part of in helping relatives make decisions as to curatorships. Social workers are now becoming curators and managing the legal aspects of a person's care, either because they don't have family members or because the family members are the actual abusers. And there's two types of curatorship in South Africa. where the High Court will assign a person to take care of the personhood of an elder. And very often this is called a curator personam, and social workers are quite active in managing the care of their elder. And then there's a curatorship bonus, which is the financial management that the Older Persons Act established. And usually these are financial organizations or legal representations. The further emerging trend is training. And here you see actually Margie doing some of her training as a social worker in her own right. And you'll see this group is a group of staff from my home receiving accreditation. And you'll even see that it included housekeeping staff, nursing staff, and even an elder. So we're moving away from group care specifically by registered nurses to a broader spectrum of care, particularly in the care facilities such as what I run. And care partners, now called care partners, are being accredited. Training of social worker assistants and aides, elders' values are central in training and practice. And there's an emergence of Zoom platforms that elders are now learning to participate in, myself included. This was a learning curve for me. IT development for elders is a growing need. And then the protective roles and legal representation services that social workers play for elders. Social workers who work in an interdisciplinary team will do well with maintaining their own skill set. So they will need good communication and mediation skills. They will need referral resources that are known and maintained. So relationships of social workers with individual care managers and legal support services is very important. They need to develop educational and reference materials, and then maintain personal development within their scope of practice and special interest areas, paying attention to self-care. Social workers will be required to hold professional boundaries. We have other elder care protection acts called the POPI Act, where the protection of personal information is supported. They need to know their limits, keep confidentiality, and enjoy family life. And here you have a picture of my friend Margie van Zyl Chapman enjoying family life and maintaining interests. Central to all social work and all care of elders is remembering the personhood of the elder and bringing it down to the very basics of maintaining the individuality of elders. So I've ended my talk with the joke of asking the question, what is working in your practice and in your country? What is not working? As a registered nurse representing the work of social workers in our practice, registered nurses always have a way of making it work. But I see social workers as an essential and integral part of the South African culture and medical field. And they're like the lubricant that help it work and hold the system together and keep things moving. So in conclusion, I would like to say that knowing your belovedness as an individual and communicating the belovedness of the people we care for matters. It matters deeply. It's personal. And I think one of the great gifts that social workers give is to recognize the personhood of the elder. Thank you very much for inviting me to participate as a registered nurse in the practice of elder care. And I invite your questions and further discussion. Thank you.
Thank you, Madam, for your elaborate presentation on the topic of current roles of social workers while working with the elderly persons. You have highlighted that the social workers have a very great role to play, both at community as well as while working with the government departments in the public sector. Okay, they have been rendering various services such as counseling and many other allied services. And you also have highlighted that there is a provision for legal representation in public and private sectors, which is a very valid point. So the elderly persons are assisted in the matters of court appearances and abusive intervention services. The social workers in the private sector have also been playing a greater role. Well, they work as care facilitators, care at home facilities. They do assessment and home visits. They conduct placement suitability, and also they help in transition counseling. Well, besides, they also provide spiritual and addiction recovery support. Besides, the social workers also render the legal referral role and intervention activities to the elderly persons, curatorship role, and in fact, you went on to say that relationships matter in the Southern African society. While highlighting the challenges, you went on to say that there are legal Older Persons Act coming up in your country. Curatorship applications and reporting issues are there. Elder abuse and emergency support is coming up. And there is a big issue of financial restraints with regard to the elderly person's lives. Now, with regard to the emerging trends and innovations, you gave us very valid points such as the implementation of social programs, like, for example, the introduction of senior Olympics and fitness programs and many other programs. You also went on to say that social worker aids services, home visits, celebration of senior day centers, active aging tax, South African Social Security Agency, and finally, you stress upon the matter of the provision of financial management. At the last, you also gave a point that social workers work as the interdisciplinary team while assisting the life of the elderly persons in the South African society. And finally, you ended your talk with a statement, belovedness matters. So, madam, your talk was very enlightening, very comprehensive, and really, informative. So now I request my participants to pose questions if there are any.
How do I talk? No, you just wait. Yeah. If he's got a question, then you just answer.
Well, would you please, I have a.
Yeah, I think I think Dr. Thandi has asked some questions. I think probably we can ask her if she's there to ask the question straight away. She has put 1 or 2 chats there. She's the next speaker.
Who?
Dr. Thandi.
Thandi.
The next speaker has raised some questions. If she's there, she can probably, post this question to her. Fine. Dr. Thandi, can you just come in?
Thandi, you're welcome.
Thank you very much, and good morning to everyone. We recognize that South Africa is a very multicultural society, and I just wondered if maybe you see any differences in the racial groups or people who come for care services for elderly in particular. I was looking specifically in those who come for residential care, and I know that for a lot of Black people, there is usually hesitance, at least here in Lesotho, because it's like you are absconding your responsibility because culturally there is that expectation. So I thought you could speak to that. I also thought we could also probably try and speak to what I'm going to talk about later, which is elderly abuse. So what is the status in South Africa? I know that it's quite high. And what role do you think social workers could play to counter this? Because I think sometimes social workers come at the end where they are assisting, but is there a role that they probably can play to counter this? Thank you very much. But lovely presentation, I have to say.
Very enlightening presentation indeed.
Yeah, is she going to respond? Yeah, it's either Lizanne or Maggie. Both of them can respond in case they think they can respond. Otherwise, we can move on. Yeah.
Thank you. In my experience, the social worker actually starts the process rather than coming in at the end. But there's a vast difference of need in the various social groups, depending on the value system of the different population groups. Certainly, there are many opportunities to tighten up the care of the population groups who live rurally, sorry, and change the attitude towards elders as to what is valuable and what is not valuable. And also there is, as in some population groups, great suspicion about elders who have dementia, and often elders are misunderstood when they have dementia and might even be accused of being witches and people who are under great suspicion. So there's a very strong need for education regarding particularly dementia care, and the aspect of elder abuse is widely misunderstood because it can be passive and active. So yes, within the population groups, there are variations that are quite extreme, from full support to minimal support, from many social workers to very few social workers, to very few private social workers in the rural committee and in the rural areas, and also the financial availability to hire a social worker to act as a liaison.
I understand Maggie is not able to unmute herself. Prabhakar, can you just see whether there's a possibility of unmuting? She can't unmute, and normally she's expected to unmute, but she says she's not able to unmute.
She can, sir. I requested her to unmute herself.
Can you try, Maggie, now? Yeah.
There you go.
Yeah.
But there's interference.
I'm going to just log off.
No, don't. There's interference because I'm close to Lizanne. There we are.
I'll just move.
Okay, that's better.
Yes, you are audible, madam. You can continue.
Sorry, there's interference because I'm next to Lizanne helping her with the computer. I think Lizanne has really summed it up. But we must remember that in South Africa, there's only about 2% of the older population who actually live in old age homes or care centers. So the majority of our elders live in the community. And elder abuse is a silent crime. It's a hidden crime. It's swept under the carpet. So the social workers' important role in combating elder abuse is to educate families. So their role as an educator, as an advocate, is hugely important.
So, very nice message. Valid message to the youths like us. Any other questions? Mr. Prince Kumar, have you got any question? Well, you can unmute yourself.
I think we should move on to the next one.
Okay.
Yeah, it's 12:30. So.
Okay, shall I move on, sir? Okay. Well, let us move on to the next speaker, Dr. Thandi Habana, Am I spelling your name correctly, madam? Habana.
I think you do very well compared to a lot of people. So Shabana.
Habana.
Yeah.
So she is a well-rounded, multidisciplinary social scientist interested in advancing socio-demographic research, policy development, and human rights advocacy in Lesotho and Southern Africa. Her research interests include aging. She is currently a research fellow at the University of Dundee, working on Growing Up on the Streets project in Ghana and Zimbabwe. She is also working with the University of Cape Town and Manchester Institute for Collaborative Research on Aging on Care of Elder Persons in Southern Africa network with a team of researchers from the University of Cape Town, University of London, and University of Manchester. She has drafted 3 national policies for Lesotho. The first one is Lesotho Housing Policy. The second one is Lesotho Policy for Older Persons, which was adopted in the year 2014. Then the third one is the Lesotho National Policy, National Population Policy for Sustainable Development. She is also a representative in the following bodies. She is a member of the National Health Research Ethics Committee, a former Secretary General of the Union for African Population Studies, and finally, she is a former President of Population Association of Southern Africa. She possesses a PhD degree in sociology ongoing with Brown University, USA. She has a master's degree in sociology from the Brown University of USA. She has a master's degree in development studies from the University of KwaZulu-Natal. Welcome you, Thandi Habana. Please take over your session.
No, but I think only question before she starts, I want to ask her, is there any qualification you have not completed yet? Is there anything left in the world on the qualifications front? Okay, right. Okay, thank you. Okay, right.
All right. I'm just checking. Do I control the presentation or someone will be doing it for me? I've just tried to share my screen. Is that okay?
You live it. You can do it. If you want to do it, do it.
Okay. Let me do it. All right. Good morning, everyone. And thank you very much for this opportunity of sharing some of the work that I do, but also just presenting some of the issues of older persons in Lesotho. I have to highlight that I'm going to take an approach that is probably different from everyone else, which is basically more of a problematization of issues of older persons in Lesotho, in particular focusing on elderly abuse. So elderly abuse, of course, is a global phenomenon, but it's been hitting us quite high in Lesotho and at least in South Africa, as I know. And I thought it's something that we can call an emerging trend, but as some of the speakers have highlighted, it's an issue that's been swept under the carpet that we often don't want to talk about. But I think it's important that we highlight it, but more so now at the time of COVID, where we saw a lot of older persons being abused. So elderly abuse is basically seen as a single or repeated act or lack of appropriate action that can cause harm to older persons. And it comes in different forms, which include violation of their human rights. It can be physical, it can be sexual, psychological, as well as emotional. And we also have abuse of older persons, which is very financial and material. They tend to be abandoned, they tend to be neglected, and they tend to lose their dignity and respect. Studies have highlighted, in particular meta-analysis from 28 countries, that about 16% of older persons report to be abused. And it is important to note that many of these cases are not reported because they don't want to expose their families and they don't want to expose themselves too. So we've seen a lot of cases increasing at the time of COVID, when young people and older persons were living together, but in particular when young people tend to lose or their livelihoods. We saw a lot of cases increasing. In particular, it was interesting to see a study in the United States that estimated this to about 84%, which is quite alarming. So focusing specifically on Lesotho, this is a Southern African country with 2 million persons, and it is highly rural with a lot of poor people and high unemployment rate, and about a quarter of the adult population is HIV positive. But it's also important for me to highlight that with HIV, there has been an increase and a burden on older persons to care not only for their adult children, but also to care for orphans and vulnerable children. All right. So the elderly in Lesotho are defined as any person who is 60 years and over, and we have about 160,000 older persons in the country, who represent 80% of the population. So older persons have been, at least they have a specific department in the Ministry of Social Development that's called Elderly Care Services, Department of Elderly Care Services. And there are different forms of assistance that has been extended to older persons in the country. These include public assistance that began in 1988. So if you were destitute older person and the chief would report you and write a letter, and then you would get assistance from the ministry. And you get about $17 a month for that. And then there is also a big one that has received a lot of international attention, which is the non-contributory old age pension that began in 2004. And it's important to highlight that this began at the peak of HIV deaths in the country. And in particular, the government was responding to a social crisis of vulnerable persons that seemed to be, or at least vulnerable children in particular, and orphans that seemed to be burdened on older persons. So older persons receive about $60 a month. And this is the only and the largest social grant that the Lesotho offers. And it is received by older persons who are 70 years and above, despite the fact that we defined old age as 60 and above. And a lot of research has highlighted the role of this pension regarding orphan and vulnerable vulnerable children's care. And then older persons have now tend to be caregivers instead of care receivers because of this. And then we have also highlighted, at least in some of the work that I've done with my colleagues, the spillover effects of these pensions on children, but also on the communities themselves. So it's not just a spillover effect on their own direct households, but it's also positive spillover effects on their communities as well. We also have the 2014 policy for older persons that I played an important role in drafting. And the policy basically advocates for the rights of older persons. And it also advocates for establishment of programs that should promote their well-being. I thought it's important to highlight that currently in the country, we only have 2 care institutions for older persons. And unfortunately, they are still B-graded, which is kind of a dormitory setup for them. And they basically do not have a geriatric care. And then a lot of older persons are, at the end of the day, cared for by family and community. And this is an expected role from a Lesotho perspective, a cultural perspective. And unfortunately, a lot of families are not receiving support from the government in this respect, except for, of course, for that pension. But we have to add as well that because of the pension, the families are happy to have an older person live with them so that they can also benefit from that pension. So in essence, the pension is not just benefiting the older person, but it is reduced in terms of benefit to the older person because now they have to care for other people. Remember, I talked about the high unemployment rate in the country. And so there is generally inadequate support from the government and other stakeholders. And then COVID-19 came last year. And when it came, the government of Lesotho, much as Lesotho was the last country to receive or at least confirm a case of COVID, the government of Lesotho was very quick to declare this as a national emergency even before the cases were reported. And quickly, the government offered cash transfers and food and in-kind support to vulnerable families, in particular older persons. Older persons tended to receive a preference in this case where they received an increment in their pension. This was also expanded to younger, older persons, the 60 to 69-year-olds. And so that was very good that the government did it. But at the same time, the problem was that with that, there was a bigger population that was suffering. Younger people had lost their livelihoods and their jobs, and then the burden of care increased for older persons. So what I'm arguing here, I'm employing a generational relation theory to say that we need not look at older persons as individuals, but we need to understand them within the context that they live in. They live in households, they live in communities. So it is important that as social workers, as policymakers, we need not look at them as individuals. We need to look at them within a specific context, therefore as social beings. We need to appreciate that there are relationships within households, within communities, and therefore any support that is extended to older persons impacts on these relationships. In particular, we have to appreciate that the care of older persons is expected to be on younger generations. But when older persons are assumed to be autonomous, then we kind of creating a conflict within society. So the research questions that my work highlight are how have pensions reshaped the relationships of older persons in their households as well as in society. Did these relationships, were they affected with COVID? So the methodology that I use for this is that I built on social cash transfers research project that I was part of from 2015 to 2019 with some colleagues. That was a DFID funded project. And then we had employed key informant interviews with the Minister of Social Development as well as elderly care services, in particular elderly care homes, the two that are in the country. We also talked to chiefs as well. We conducted focus group discussions with older persons and conducted in-depth interviews with persons that were particularly affected or abused during COVID. What the results showed that there seems to be a shift in responsibility for older persons. Pensions appear to have basically made older persons more autonomous, which is good because the assumption is that they are now able to take care of themselves. But then, like I said earlier, that creates expectations. Now we have older persons being shipped to different households where then the money can become part of a household. We have children being shipped to older persons' households so that they can be cared for by older persons. So we also see that there is a cross-generational obligation. So older persons are traditionally expected to be cared for by their adult children as an expression of respect, of course, also as a responsible person and member of society. But many elder persons tend to spend their pensions and prefer to spend it more on their grandchildren and are very much reluctant to spend it on their adult children. And that kind of creates tension. Yes, you are happy to help my child and I'm happy with that, but I also need help. There was an interesting one that the older person would say, I am lending you my money. So instead of contributing directly to the family pot. There's also, we're observing that there's a shift where we are seeing moral duties where young people or young adults were expected to care for their elderly, we see a moral shift into an economic transaction. And we have seen that a lot of younger people now, instead of offering assistance to older persons, they were offering it as a service that is paid for. So that bringing of cash kind of created that shift. And so we see old elderly people paying for chores, which include collecting of wood, laundry, collecting of pension, because usually this is basically collected from very far away places. And therefore, sometimes if the elderly is not able to walk, they would normally ask younger persons to go and collect for them, but then they have to pay for that particular service. And of course, we see that a lot of older persons are not begging as much, but instead we are seeing that they are seen as lenders within the household. They are seen as lenders within the community, but that in itself is a problem. We also observe relations of indebtedness, where we see that because old age pension in a lot of communities seem to be one of the main predictable regular incomes, older persons are trusted to lend, like I said, but their money is also seen as a collateral. So you can go to a store and say, my grandmother asked me to come and get oil, and this will be paid for at the end of the month when she receives her pension. And it is reported by older persons that unfortunately the shopkeepers would just exaggerate their prices just so that they get more out of this. So elderly tend to say that they are expected to lend money, and unfortunately if they say no, the younger people get very much offended and angry. As a result of having this cash in a context of high poverty and high unemployment, older persons become very vulnerable to crime and abuse. They reported that retailers tend to charge them exorbitant prices, sometimes double the price. They report that collection days are usually not very much reliable, so they keep going to collect at the center point where they're supposed to, and then when they get there, they are told, no, not today, come tomorrow. And the pay points, because they are far, they tend to be attacked after collection. And even the chiefs tend to charge them money for just writing official letters that are endorsing other people to collect for older persons. And then the grandchildren they're burdened with grandchildren, like I mentioned, to take care of grandchildren. Like I said, the grandchildren would be just shipped to older persons' home so that they'll take care of them. And then we also have cases of elderly being attacked. I thought I should just relate these 3 cases just to highlight what I'm talking about. We have an elderly person, and this is a pseudonym, Mapaseka, who's 88 years old, and she lives with 3 grandchildren and 2 great-grandchildren. Some of the children, the parents are dead. Others, the parents have left them and went to South Africa. So the house is very old and deteriorated and doesn't seem secure. In fact, the door is basically, they use a stick to close the door. So one night, a younger person came and just broke that door on the 19th of June. And she was attacked by a neighbor who was asking for money, and the neighbor raped her. We also have Madineo. I said these are pseudonyms, who is 72 years old, and she lives alone. She was raped by young boys in the community, and she now hates men. She's been admitted in an old age home, and apparently at any sight of a man, she throws stones. We have Matepo, who is 83 years old, who was killed last year by her son, who was demanding money. So we seem to be having a problem. And so for me, the argument that the issue that I'm trying to put forward here is that while we are trying to offer social protection to older persons, we need to contextualize this intervention to understand that as older persons are the only persons who have money, we are creating a society that is unequal, but older persons physically are vulnerable and they cannot fight for themselves, and therefore that creates a vulnerability. They tend to be attacked, they tend to be raped, they tend to be killed. Pensions are making older persons and their households susceptible to harm, much as we're supposed to make them less susceptible to poverty. So interventions need to be understanding of social relationships, that older persons as carers, they are now becoming caregivers, not care receivers, which is quite a burden. There seems to be that shift from moral obligation to economic transactions. And there seem to be tensions within households and communities due to that inequality that has been created by the pensions. And therefore, it is important to think about household and community processes interact with wider structural changes. So at a time of COVID, when we only assist older persons, we need and leave everybody out. We are making them vulnerable. And we also need to think about the role of social workers in terms of being able to assist, like I said, in curbing this epidemic that we are seeing. And this is a quote from an older person who says, "We are praying that others be helped." This was said to be social development. So others need to be helped so that we all move forward. Thank you very much for your time.
Absolutely fabulous.
Marvelous.
Fabulous.
Very extensive,
Fabulous.
elaborate presentation, Kandi Abana, where you spoke on the topic of targeting older persons at times of the crisis in Lesotho. Well, you also highlighted the points that is, whether it is social protection or social conflict. Under this title, you made the presentation. Well, you started off with the statement that elderly abuse is a global phenomenon. Particularly in the era of COVID-19 pandemic, their problems are on the high. Well, you also focused your speech on the life of elderly in Lesotho, particularly their care and protection. You also have given the theory of generational relations, while caring of the older persons should be handled by the younger generations. You have put forth the research questions, 2 research questions, and also the methodology. And at the end, you validly discussed about the results, particularly with regard to number 1, shifting of the responsibility of the elderly. Okay. Secondly, you also highlighted on the moral duties to be performed by the younger generations with their elderly persons. You also made a very clear point on the relations of indebtedness, the vulnerability of the elderly persons to crime and abuse. And you also very neatly presented 3 case studies about the problems of the elderly persons being faced by, being faced at Lesotho. Well, you also gave a very valid take-home message in the form of intervening in social relations, and very validly highlighted the role of social workers. Thank you so much. It was a very scientific and systematic presentation. I request the participants to put their questions in the chat box if there are any.
I think she has spoken so beautifully. Absolutely lovely.
Yes.
I think for a last speaker to keep, I think if this was a conference in an international seminar, I can tell you all the 500 people or 1,000 people would have stood up and then, given her a standing ovation that we are not able to do today.
Thank you.
Let me tell you, I think today some of you, I don't want to mention, but let me tell you, some of you have really said what social workers can do. It's just, I think for the first time, probably I have heard exactly what social workers can do, much more than what we have understood. I think you all, particularly, Lizanne, who's a nurse, working with a multidisciplinary team, says that this is what social workers can do. And I think it's phenomenal. And the first presentation from Philippines was absolutely wonderful to say what they can do. I think I would personally feel extremely, mightily thrilled that we could really get to know. I think there are 9 universities, 10 universities here who have a lot of take-home points, like Dr. Chandramouli said. I think all of them will have to go back to do homework on social work, what could they do? And Dr. Tandy, let me tell you, we are not going to spare you in the future. We will trouble you adequately. We'll keep calling you for these meetings because some of you can really inspire the social workers whom I often feel absolutely low. Social workers don't feel high about what they do. I think they are probably, becoming insignificant in a multidisciplinary approach unless they have really, done something significant. I'm extremely happy that African trend country seems to be doing very well on the social workers front because that's what we have seen from the South African, and now we have seen it from Lesotho. I think it's interesting. Countries like India and China, and perhaps Indonesia, there's no social workers, they were telling. So it's phenomenal that the number of people, I'm talking about the number. We're all talking about more than 150, 200 million old people living in 3-4 countries where there are no social workers practically. When I say no social workers, I don't mean literally no, but practically insignificant. I think this is a phenomenal learning, particularly for me. I'm very sure a lot of people who are in social work from the institutions, universities will like it. I know that I'm going to request Dr. Chandramouli to close this session and take these questions to a later time because it's already 1 o'clock. Okay. Thank you once again. And I want to thank every one of you for making it wonderful for us. And I just want to remind you before I don't want to come back, Dr. Chandramouli, you will, when you give the closing, I'm sorry for the interruption. I think the sessions on 3rd, 4th, and 5th of August will be Indian time 5:30 to 7:30, EST 8 o'clock. Those people from the Western side would realize it is 8 o'clock EST and India 5:30 Indian time. So I'm sure you would be able to convert it the way that you want. I want to tell you 3 days is not enough. 3 more days won't be enough. But don't miss any talks given by any of them because we are going to have some interesting speakers coming from particularly the Western world, which has experienced social work function much better than those in the East. So don't miss those occasions, rare opportunities. I'm sorry, Dr. Chandramouli, I took an interruption on this. My apologies.
It's okay, sir. Anyway, dear participants, it was a mind-blogging and enlightening day for all of us. All the 5 speakers, Dr. Evangeline Mahine Ginto from Philippines, Mrs. Eva P. Pons D. Leon from Philippines, and Mrs. Varadagauri Vasudevan from Sri Lanka, and Matron Lizanne Painter from Southern Africa, and finally, Dr. Thandi Abhana from Southern Africa have really given us thought-provoking, highly scientific and eye-opening sessions to all of us in the field of geriatric care. And they all have highlighted that the role of social workers in the field of geriatric care is going to increase in the future, right? So it was a wonderful day because as I have found out, there were around 300 participants in today's session. I definitely thank all of you to be the participants of this session. So I conclude today's session with this. Thank you so much for being with us. Thank you.
Please kindly fill in your feedback and please remember, unless you attend 6 days, we don't give certificates. Therefore, we would expect you to work all the 6 days so that you get good certificates. Let me tell you, none of you will regret attending these programs. I thank you very much, Dr. Chandramouli, for I think you had a wonderful points of takeaway, and I'm sure people who are going to see this in YouTube, we will share this YouTube with us. I'm requesting Prabhakar to share the YouTube link of yesterday and the first day and second day in the chat box so people can copy it and they can view it. I think Dr. Prince Kumar from New Zealand has asked for a copy of this presentation. I think the YouTube link that we are going to paste it tomorrow or day after tomorrow will be very useful for you permanently. Thank you so much.
Thank you, sir. Thank you.
All the very best to all of you. Take care. Thanks.